Okay. Hello, everybody. Good and welcome to the Health Gospel. Welcome to the Health Gospel. Just checking everything. I'm just checking everything is in order. Okay. Welcome, guys. The Health Gospel. Right. So, welcome. And today is another interesting topic we're going to be dealing with today. So invite your friends to join us. We'll just give a minute just to wait and see people joining. Why is there untimely death in my family? That's the topic today. Why is there untimely death in my family? Is it a generational cause? So that's the topic today. Right, and today we are, for the first time, we are streaming on Facebook and on YouTube at the same time. So if you want to go on YouTube, it's the Health Gospel, or if you want to join us Facebook Live, it's always a pleasure to have everybody here. But some people have suggested they can't come on Facebook. We prefer YouTube. So yeah, we have acquired this means of streaming both on the Health Gospel page on Facebook and also on our YouTube page, the Health Gospel. So you can join any of them. You can join any of them. I can't see. Oh, yeah. Good evening, Francisca. Nice to see you, my Mary. Hello. So yeah, today is the first day we are streaming both on our YouTube channel and our Facebook page. I'm so excited. I just checked it and yes, we are on and it's working. So yeah, I'm so excited. My name is Dr. Idee Charles, and we know today's topic. Today's topic is quite interesting, is a topic that we need to know, especially in Africa. So I'm asking that you share this video. I'm asking that you invite friends. I'm asking that you please share this information, share the video so that people can learn. When you get information, you are empowered to change things around you. If you don't have information, you can die with ignorance and you will never know. So this is why we want us to know today, what is been going on? Why are we having this discussion today? So why is there untimely death in my family? Is it a generational cause? This is the topic today. Yeah, we are on. So why is there untimely death in my family? Is it a generational cause? This is the question. This is the topic. Is this a generational cause? What do you think? People are dying in my family. I mean, why would you say that every time it reaches the age of 40, or okay, give it to 50, they don't reach 50, they don't really reach 50, somebody has to die? It is, they say, a male child has to die before they reach the age of 40. There is something in this family. There's something in our family. We need to break this cause, because in my time, I don't want to die when I'm 40. I don't want my senior brother died before, father died when he was almost doing his 50th birthday. My sister died when it's always the same pattern. Is always like, okay, there's something wrong, there's a spiritual problem, we have to pray, we have to fast. And then they are waiting to pounce on you and finish you. You just go and tell them, oh, people are dying in my family. What can I do? And then a means of them sucking money from you. So they begin to take money from you. Oh, grandfather did something, they planted something somewhere, and we have to go and remove it. You need a family deliverance, and you pay it. People are still dying. They now tell you the thing, is very powerful. It's a very powerful thing. So people are still dying. As you have to pay the type of deliverance we need to do, you need to pay this amount of money, and it runs in thousands of them. People are still dying, and nobody has asked, please, why are people dying? Why are people people have not really sat down to say, is there something more? Or we just believe that is a generational. You are born and you die, and then another person dies, and people are just dying. Nobody cares to really pause going on. Could there be something that we are missing? Even along the line, it has happened to your father, and all the sons are dying. Nobody is asking, oh, is there something wrong? Is there something I need to do? I'm missing. And today we are talking about untimely death in the family. What is going on? What can we do? This is why we're here, and we're asking you to please join us as we go along to explain why is there. So we look at our makeup. Our makeup, we have what is called gene. Gene is a functional body, the makeup of the body. And this makeup is, there are DNAs, there are proteins that make up every aspect of our life. Our skin color, our expression, the things we do, they are things that make up who we are. And their genes are inherited. These genes are also given from us, from the parents to the children, passed from parents to the children. So if there is an abnormality in that protein, is the protein I'm calling functional unit of heredity, is the functional unit of your inheritance, what you are made up of. If there is an abnormality in that gene, it is also going to be passed. Abnormality is also going to be passed to the children. There are some that are passed either only to the male, are passed to both the male and the female children. Please share this video. It's very important. It's going to save. So if there's a defect in the gene of your forefathers or your great-grandfather or your great-great-grandfather, that fault to his generation, to his to your great-grandfather, your great-grandfather, your grandfather, yourself. Let's take, for example, I'm giving you example. I will name all the inherited disorders that are killing generational cause. For example, we are looking at sudden death. Suddenly in my family, sudden death syndrome. So we call it sudden death. Or let's look at cholesterol. There is an inherited hypercholesterolemia. It's a big name, but I'll break it down. What does it mean? It means that there is a defect in the gene that have been passed down to me. So when I'm born with high cholesterol. I am born with, which is the LDL, is the bad type that causes heart attack. And because I have not been, I don't know it. He just died suddenly, and I have been growing without a father. And then you don't know that correct, have inherited hypercholesterolemia. So your cholesterol is high not because of what you have done, inherited this default gene. Now you are having high cholesterol without knowing from birth. Lifestyle we are living because, oh, my friends are eating meat, or I'm eating good, I'm drinking. You are adding salt to the injury. So you are building up bad fats, bad LDH, which is what lines up the blood supply of your heart and the blood vessels of your heart, and it leads to heart attack. So you are a time bomb waiting to explode because you don't know it, because your father didn't know it, because your great-grandfather didn't know it. So people are dying without knowing, and we call it generational curse. So this inherited hypercholesterolemia is when you inherit a disease gene which causes you to have high cholesterol and exactly LDH, low density lipoprotein. LDH is the bad cholesterol. It will cause you to have heart attack at a young age. It is said that 85% of people in this family that have this condition, they die between the ages of 40 to 50, the males. The female can stay longer, maybe up to 60, but they will still die. Can you understand? Do you understand that? That is where people die, number one. That's one of the conditions that people are dying. And you say, my brothers are dying. Why are they dying? They just die suddenly. Have they ever checked their cholesterol level? When your great-grandfather died, probably, yes, we were not aware. When your father died, was there an autopsy? Did we want to find out why did my father die suddenly? No, because religion has blinded our eyes. We are only looking at who caused the death in my family. We are not looking at what can cause this death. Why are people dying? Doctor, I need an autopsy. I need to know why people are dying. I need an autopsy. I want to find out, is there something running in the family to protect yourself and your loved ones? Nobody will do that. Nobody finds out that we are pursuing one uncle, pursuing one auntie, one old woman living in a thatched house. Everybody is labeling this old woman that this is the person that is the cause of my problem. So we label this woman, she's the one of the young people in my family. But there is an inherited problem. Probably number one, I'm talking about inherited hypercholesterolemia, which has been killing people without people knowing. And it kills the males between the age of 40 to 50. Have you heard when people tell you, in my family, nobody lives beyond the age of 50? Is that common? Is that a common thing? I've heard it many times. Is that a common thing? If it is a common thing, then there is something which can resemble inherited hypercholesterolemia, meaning you are born with high cholesterol level, high LDH level, which will cause you to have a heart attack at the age of 40. If you live to 50, you will have a heart attack. 85% of males in this family, they do have a heart attack at that age. Let's start being human. Let's start living in reality. Because this spiritual life we have been living is causing us to die in numbers. Ignorance is what is causing us to die. We are inheriting ignorance and dying from it. So when there is a default in the gene, I pass a default gene to my children, or my husband pass a default gene to the children. So if I have a default gene that is carrying an illness that can be passed in the gene, so I will pass it on to my generation. You will pass it on to your children. Is it not better for you to find out what is going on so that you can prevent? Like this condition I've talked about, inherited hypercholesterolemia, when people know in my family, this is what we have, you know what they do? They put them on medication. They give them strict lifestyle. They give them strict diet. They put them on medication to continuously, permanently reduce the cholesterol level. So they will never be in a position where their cholesterol is high. But in my country, in my continent, Africa, we don't want to know why my great-grandfather died, why my father died. We are pursuing enemies. We are pursuing enemies, and that is why we are dying. Somebody died in my family, my brother died. I have been in places where people said, I'm doing a big celebration because I'm the only member of my family that has survived beyond 50. So I'm doing a celebration. And as soon as he does the celebration, he dies. And then you say, because he celebrated, he wouldn't have celebrated. But the illness is there. It was lingering. Maybe that young man probably used to exercise, probably used to eat well, but there was something there. It wasn't caused by an enemy. It wasn't caused by the old woman in your village. It was a defect in the gene that was passed innocently down to him by his parents. So every of your family members have died without you knowing. Now we are doing all sort of things, going to the mountain. You're living in permanent fear because you are afraid of your life, because you're afraid that I'm the next in line. This course is coming to me. I am the next. I'm 35. You start going everywhere. You start running about, doing fasting, praying, looking for prophets. But that genetic disorder is there. So if you're listening to me, or you will listen to me, please, if people are dying in your family, this is just one condition. I have so many I'm going to mention. You need to go for and submit yourself for a full medical examination. So inherited hypercholesterolemia is very common and is killing people. Somebody would say, oh, it's the Yubo disease. No, because we have not gone to do autopsy to know what killed my grandfather or my father or my senior brother. Instead, what did we do? During the burial, we called pastors to come and pray, hold hands. This death cannot repeat itself in this family. We put an end to it. We put the pour oil, they pour water, they pour all sorts of things. It's still there in your body. Is still lingering in your body. The next person, you're just waiting till the age, it will attack you. This inherited gene, they will die of a heart attack before the age 40 to 50 years. That is just one. We have other conditions I'm going to be mentioning. The second one we'll talk about is coronary heart disease. Coronary heart disease is also inherited. We can call it inheritance disorders, whatever you want to call it. Coronary artery disease is disease that affects the blood vessels that supply your heart. It affects the blood vessels that supply your heart. You are prone to heart attack. So because so many people that die back home, suddenly it's either they had a heart attack or they had a cardiac arrest. If they had a heart attack without knowing, probably in my village, they had a heart attack, is there. The next minute they're going to go into a cardiac arrest and they will die. Because heart attacks are very high risk to cause a cardiac arrest if it is not treated. And nobody knows what is going on with this man. You just hear he's groaning, and it then collapses. So he has had coronary artery disease for all these years. Without knowing. And then he has a heart attack and he's in his office. The brother died the same way. Oh, the sister died the same way. Why are they always collapsing in that family and dying. We will not allow our daughter to marry there. Everybody in that place, they're always dying. Don't you see that there's evil in that family? Or they say the father is using them to make money. We give all sorts of names to these things. We say all sorts. The only thing we don't address is the truth. The only thing we do not address is the truth. We address the lies, we blame people, we accuse people, we give all sorts of theories. When the great-grandfather wanted to build this house, they told him not to build this house in this place, that there is something in that land, but he said no, he's going to build it there, and then he went to build it there. Now all the sons are dying. There is something. That is why knowledge is power. You get equipped with knowledge. You get equipped with knowledge. You get equipped when you have knowledge. So we have coronary artery disease that is causing a lot of, so you have this inherited disease. Now you don't know. So you are living like every other person. You smoke, which will even add to the problem. You drink. All your friends go out to drink, you drink. After all, you don't know what is the problem. Most of you people just die in your family after you mourn, after you've prayed, after you've done your deliverance, you back to your normal life. So your lifestyle doesn't change. So you go back to your normal life, and then it's your turn because it's there. So you die. Next in the line dies. The children you have given birth to, they are also next in line to die. How many people will die before we begin to seek knowledge? How many people will die before we begin to seek knowledge? Why do we go and do celebration and we go and do 40 days fasting? Because I don't want this death must end with me. I put a barrier, I put a stop, it's inside your gene. Are you going to remove the gene and change it? There is a defect in the gene that is being passed down from your generation. There is a defect. And all you need to know is seek information, seek to know, seek to understand, seek to know what is the problem. What, not who. What is the problem? Why am I having this difficult? Why are people dying? But I have looked at people, especially when people are, that's why I'm doing this topic, because somebody have given me this story that people are dying in my family, Dr. Idee. I am scared. I am next in line. And I started thinking, because of the pattern of what you are saying, is something that is inherited in this family, something that is inherited. Have you cared to find out? Oh no, they say it's generational problem. No, we have been fasting, we have been praying. I said, no. There is something. Nobody has ever done autopsy. No, when we die like that, like the last time my brother died, we called the pastor, we called the regional, everybody came, they prayed and prayed and prayed, and you are afraid. Sleep have eluded you. You are living in anxiety. You cannot, because you know you are next, because that big witch in the family is going to kill you. But the genetic defect, that example, inherited hypercholesterolemia, all you need to do that, okay, my cholesterol is high, is not because of you, it's because of what you have inherited, what has been passed down to you. So I'm strict on my diet, I need to be strict on exercise, I need to be on medication. And you can live 80, 100. That's all you need to do. But we are dying because of ignorance. We blame it on the devil. We blame it on the aunties. We blame it on uncles. We blame it on the old woman that is struggling to even eat. That has nothing to do with her. So we talk about heart rhythm disturbances. Heart rhythm disturbances, I did one of them called atrial fibrillation. Atrial fibrillation is when your heart is fibrillating, sort of doing like this, fibrillating. I have a video on it. You can check it on you have lots of video. That is just one of the abnormal rhythms. We have inherited disorder where the heart, the rhythms are abnormal. You have heart rhythm disturbances. And also it is a defect in the gene. So these people go into dangerous heart rhythm. There are some heart rhythms that are not compatible to life. So now we are in what is called sinus rhythm, normal rhythm, normal rhythm. The heart is beating normally. In abnormal heart rhythm, the heart is not beating normally. The heart may be too fast that the body, the life cannot sustain, it cannot sustain life. We can go into dangerous rhythms. I will mention few, but they are big names. So we have atrial fibrillation. You can go into ventricular tachycardia or ventricular fibrillation. So your heart muscles is just going like this. So there is no blood being pumped. It's just going to, how do you call it? Just going, beating fast, just being stimulated actively. That is ventricular fibrillation. There is no pattern, it's just beating. And then before you know it, because it's not pumping blood, and blood sustains life. Blood carries oxygen that sustains life. So if the heart is not pumping the blood, before you know it, this person cannot survive. We call those rhythms, they are not compatible to life. So these people die. So if you inherit a disorder that is causing your heart for you to have abnormal rhythms, there are some of them that are not compatible to life. And at every given time, those rhythms come up, you are going to die. And pushed it to come out early. Probably your environmental factors, you have other medical problems that have pushed it to come out faster. Probably you used to feel it. It comes and goes. It just comes like palpitations. You get lightheaded, you feel dizzy, and it goes. Probably those are the warning signs. But we are so religious and spiritual to even think about ourselves. And that's what I talk about on the health gospel. We are so spiritual, we are so religious to even think that something natural can happen to us. Everything we feel is spiritual. Everything that happens, every sign, every symptom is spiritual. There's something, somebody wants to do something to you. Are you the only human being on the surface of the earth? Why is everything wanting to attack you? You have not paused to find out, let me get myself to the hospital. I know it's difficult, but I'm talking about learned people with money. So if learned people with money cannot even solve this problem, what about poor people in the village? Ooh, there's no hope. I'm talking about you that is with your money. You have not gone with that symptom to say, look, doctor, I need to find out what is going on. Because sometimes when I sit down, I have palpitations and it comes and goes. So we don't until when it happens and we die. And then hell lets loose. Everybody's accusing everybody. They accuse the wife, or they accuse the husband, they accuse the grandmother, the mother-in-law, the father-in-law, everybody. There is a mess. Why? Because we lack knowledge. We lack knowledge. We lack knowledge. The number 4, I think I've mentioned 3 now. Number 4, I'm going to talk about is cardiomyopathies. Cardiomyopathies, I cannot type and talk, but I will type all these conditions when I finish. I'll put them all out when I finish. Cardiomyopathies are diseases that affect the heart muscles. They affect the heart muscles. Now, why is it important? Because it is inherited. They are inherited disorders. Cardiomyopathy, if you remember, Papilo, what's that his name? Kanu Wankwo. Kanu had a heart condition, inherited. Kanu almost died because he collapsed. But because he went in, I think he had a heart surgery and he was restored. He now came back and gave back to the society and was helping people with heart disease. We had another footballer from, he was an African playing for one of the leagues. And he collapsed. I think Mwambe, I can't remember his name. Some of you men will remember his name very well. Mwambe. If you remember his name, you can type it in. I don't remember his name very well, but he used to play for Bolton. Now he was playing and he collapsed. This is Britain. His heart stopped. He had a cardiac arrest. They had to freeze him. They had to take him straight to the cardiac center, and they saved his life. Since after that event, he has not played football at all. He plays for Bolton Wanderers. I can't remember his name. Thank you very much, Brother Benga, but I don't remember his name. He collapsed, but he was saved. He's alive, but he's not playing football anymore. He talks about his story. You can search, you can see his story. So we have what is called hypertrophic obstructive cardiomyopathy. These are heart muscle problems. They are inherited. They are not given. They are not spiritual. They are inherited. It's a defect in the gene. You hear me use this word over and over in this program, a defect in the gene, a defect in the gene. So the muscles of the heart are important. Why are they important? Because they help to pump blood. If you have strong muscle, you know you are strong. You say, oh, this person is strong. You can lift things. Your muscle contract. The same with the heart. So if you have good muscles, so the muscle contracts to pump blood out into the body to supply oxygen into the body. Yeah, thank you, brother. It's Fabrice Mwamba. That's his name. Fabrice Mwamba. That's his name. So the muscle of the heart contracts to pump blood out so that you can have enough blood circulating in your system, into your head, your body. Blood carries oxygen. Now, if there's defect in these heart muscles, what you will find is the muscle, because the muscles is diseased, is not going to be able to do this job. Some of them are restricted, very, very big and stiff. So they are not able to do this job. It's okay if your job is just sitting down in the office and typing. If your job, you're just easy, you're going to school, you're easy life, you're okay. You may never know that you have this problem. But people are dying in your family. But you never know that I'm also carrying this problem. I'm also carrying this illness. I'm also a ticking time bomb, ready to die. So what do? Somebody say, oh, we need to start exercising, this our belly fat is beginning. You say, okay, I need to start. And then you begin to run, or you go into sports. And you get into sport because the muscles of the heart is so stiff, is not able to give you that output that you need to sustain your exercise. You collapse, you die. You collapse, you die. Why? Because you had an underlying inherited disorder that nobody knew. And while you are dying, remember you have passed this gene to your child. So when you are dying, you have passed this gene to your child. So perhaps your child goes into football, or your child goes in to do anything strenuous. The same is going to happen. And it's got nothing to do with the old woman in your village. It's got nothing to do with your mother. Your mother is not the witch destroying your life. It's not your father. As they will tell you, we need to conduct family deliverance. We need to remove this cause from the family. Know that it is right in your gene. So if they want to remove it, tell them to remove your gene and wash it and remove all the damages, all the defects. That's the only way they can remove it. That's the only way that this can be removed. If they cannot remove your gene is carries the DNA, which is the functional unit of your body, of your life. So if they can remove this functional unit, then they are doing deliverance. If not, you guys are swimming in the same ocean of ignorance. You paying the prophet, and the prophet that is praying for you, commanding and shouting, you guys are swimming in the same ocean. The Bible says, you shall know the truth, and the truth shall set you free. If you don't seek to know the truth, you will never know the truth, and you will never find that truth that will set you free. When people are dying in your family, stop looking for who is killing them. Start looking for what is killing them. We are moving to the next condition, hypertension. People say, oh, I didn't do anything. I used to live a good life. Oh, why am I hypertension? Your father had hypertension, or your mother had hypertension. Oh, didn't know, and they didn't take medication. They just live their life. They eat apple. They are all ongoing. They don't check your blood pressure at all. These days, people are even trying to check their blood pressure. People don't check their blood pressure. It goes up to 200, 250, 300, 280. I've heard people have 280 over 120, over 150. Sometimes I imagine how life survive. Some people can just not die. 280, 300, they are still walking about. And then one day, bam, they have a bleed, they die. They say, hey, this is how the father died. Now the son is dying like this. There is something in this family. Hey, spiritual. Oh, there is something. We need to find out who is doing this. We need to find. My friend, you need to go and check your blood pressure. If somebody dies young, it is there is a need to do autopsy. It is for your own good. Stop telling the hospital, I don't want any autopsy on my father. I don't want any autopsy. It is for your own good. Autopsy is good. It will tell you what killed your father. And that is what you will do to protect yourself. Don't stop telling people, we are taking our body. We don't need any autopsy. We don't need anything. Autopsy is good. Please, somebody type it in there for me. Autopsy is good. Autopsy is vital. Autopsy is important because it will help you to discover why he died, why she died, and also protect yourself, because your loved one will not want you to die the same way he died, ignorantly. So he wanted you to know, okay, it's because of my heart I died. My son, I don't want you to die like this. So please, my son, check it for me. That is what your loved one would have done. We are on YouTube. If you cannot join us here, go on YouTube. And guys, subscribe to the YouTube page, because we'll be having short videos there. Now that I have somebody doing it, managing it, I am happy, because I had this channel for a long time. I cannot manage, but God has given us somebody who now said it is my duty to do this, so we can push this information out. So I'm pleased and excited. So guys, go and subscribe to that channel, because that will help me do so many videos that I haven't done. So many topics, doing these videos, sending it to him, and he will just put it there and we can see it, because we need this information. We need it. We need it. Autopsy is good. Autopsy is vital. You wouldn't tell me I cannot do autopsy. I don't want autopsy on my mother. Autopsy is good. So diabetes, I don't know how many I've mentioned, like 6 now. Type 1 diabetes kills so many people. And It is inherited disorder. I'm not going to talk about those inherited ones that cause like learning disability, complex learning disability in behavior. No, I'm talking about the things you don't see. Because if we have a child, for example, that has Down syndrome, which is an inherited chromosomal abnormality, we will see, because the child will have outer appearance, outer expression. They will do the test. You will know there's something not right with this child, right? But these things I'm talking about today, this person is pen, correct, beautiful, handsome, healthy, but there is something wrong that is going to kill him. These are the conditions I'm talking about today. So type 1 diabetes is another inherited disorder. If your father had type 1 diabetes, you will have it. There's no need saying, I'm going to pray, I'm buying the spirit of diabetes. You're still eating Gary. Me and you are in the same boat. You're still eating Gary at 10 p.m. You're still eating sugar. You're still adding weight. Your lifestyle is rubbish. You are saying, I am praying. They do program. The program for this week is 7 days breaking generational curse. You attend all the 7 days. My brother and sister, I'm sorry to burst your bubble. You are wasting your time. Like millions of people wasting their time. Wasting their time. I'm telling you, complete waste. 21-day breaking generational curse. You have not changed your lifestyle. You know there's type 1 diabetes in your family. What is type 1 diabetes? I have done this topic on the health gospel, but I'm going to give you a nutshell what I'm talking about. Your body needs insulin. So when you eat, it breaks down to sugar. Your body needs insulin to push this sugar into the cells. What is type 1 diabetes? You have complete lack of this insulin. It's not there at all, and it's a defect. It's not there. You don't just have insulin. You cannot produce it. So when you eat, the sugar builds up, nothing to help it push it into the system, nothing to help it push it into the cells. Your cells are dying because your cells need sugar. They are dying. They are crying, I need sugar, but there's not. So you begin to feel thirsty. You are losing weight because you're peeing all the sugar out. Your muscles are breaking and forming this dangerous compound. And unfortunately, with type 1 diabetes, you form what is called ketoacidosis. It's a condition. You go into coma because those toxins get into your brain. You go into coma and you die. Why would you die when your father had the same condition? Why didn't you know? Because religion, ignorance has blinded our eyes. Until you come out of ignorance, until you come out of religion. That is why the Bible says, my people perish for lack of knowledge, not for lack of prophets, so not for lack of churches. There is every street in the country. You can have proliferation of all the temples and cathedrals and parishes and thrones and domes. And if you don't seek knowledge, you will also die like chicken. Whether you are rich or poor, you will die like a chicken. That is the truth. If you don't seek knowledge, stop living in denial, stop wanting to cover up. We do this a lot in Africa. We pretend a lot that is not happening. No, it will not be like this. Instead of facing the problem, it can always be yes or no. I've counseled so many people say, I don't want to go, I don't want to know, I'm afraid. What about the destruction? Is it not better to go submit yourself? Is either you have it or you don't have it. Why are you, I will pray about it. My pastor, we have done, we have prayed, and we are fasting, and we have, no. We need to begin to tell ourselves the truth. We need to begin to face reality. Me and you, all of us. It's not working. This abracadabra is not working because God does not work that way. We cannot box God. He cannot be boxed. You can't box him into your small, ignorant mind. No, everything you need is there. He's given it to you. All that you need to live, All you need to do is open up your mind and begin to seek knowledge. Like here, we are sitting here, we are seeking knowledge. How many people will come and seek this knowledge? Giving to you free, helping you. I'm not asking you to pray me for generational curse breaking. I'm not asking, I'm just telling you to seek knowledge that will help you. That money you need it to eat, not to pay to prophets to go and deliver you from something that is in your genes. You need that money to live well, to buy the medication you need to help yourself. Type 2 diabetes, we've talked about type 1, is inherited 100%. Type 2 is lifestyle. And some, if your parent had type 2, you can also have it. A lot of people, yesterday I was having a discussion with a brother who just texted me and said, Dr. Idee, you should do a topic on kidney failure because so many people are just dying from kidney failure. I said, I know. I have done kidney failure twice. How many people are watching it? How many people are looking at it? You still fall into the same mess. If you have diabetes, you're not looking after yourself. You're not taking medication. You are hoping upon hope. Let me explain. Now, if and this is what I say a lot on this page. If God really wanted to perform a miracle, heal you, you prayed and you've prayed and you prayed. Do you really think God is deaf and dumb? God cannot hear you. He has hard on hearing. Do you really think God is hard on hearing? He's not hearing you? Father, please deliver me. You wake up in the middle of the night, you're crying. Can you, as a human being, live in the same house? Every day your son is crying, Daddy, please, deliver me, help me. And you still not, you don't help. You don't go and ask your son, how can I help? He's crying for help. Mommy, help me, help me. And you still not help? Oh, help me. 2 years, 3 years, you're praying the same prayer. You think God does not hear? He hears. He hears, sister. You know the problem? He has given you all that you need to live. So he did what? He has science, medicine, technology, everything you need is there. Why are you closing your eyes to them? They're there. Why are you closing your eyes to them? So your blood sugar is always high, is always high, is always high. What is it doing to you? It's causing complications into diabetes nephropathy, which is kidney disease from diabetes. You go into vascular complications, heart problems. At that point, you have started even blaming people do wrong. Some of you that don't blame people, you start blaming yourself. What did I do wrong? It is the life I used to live. Is that life when I used to be a young person that God is punishing? No. God cannot punish you. You are the one punishing yourself with ignorance. You are already batting in the ignorance. See, what are you? You are just, but you are wearing it like cloth. That is what is punishing you, not God. Because the doctors are there. Every day they are producing new diabetes is gone to another level. New medication, tablets, injectables, all sorts, lifestyle changes, they give you all sorts. You are the one closing your eye for your solution. And then you're crying. Sometimes I believe God always look at us and like, just look. Wait a minute, this my child. Is he okay? Is this my child okay? It's like, your child just finished eating now. And he's coming, Mommy, I'm hungry. Are you okay? This is the way I think God always look at us, especially in Africa. These Africans, this my children in this part of the world, are they okay? Are they okay? Why are they still calling? I've given them all these things. This is the way I think God looks at us with our ignorance. You have allowed yourself to just die. Kidney failure, chronic kidney disease. I have done that topic. So search for it on the Health Gospel or on the YouTube page. It will be there. Chronic kidney disease goes through stages. Before you see somebody asking for money for dialysis and kidney transplant, he has passed through stages. I'm going to do this video again. You have stage 3, CKD stage 3. So many of us are on stage 3. It will not cause you any problem. But on stage 3, you are in the warning alert zone. Know what you're taking, know what you're putting in your body, know that you don't have to follow the lifestyle of everybody. All these herbal preparation, it is roots, it is supplement, it is this. My sister and brother, if you are in CKD stage 3, I don't even know why I'm deviating. You are jumping from one formula to another because they promise you car, they promise you trip to Malaysia because you have not seen Malaysia before. Sorry, I have to say it as it is. They promise you a car, and because of what? A brand new car. You are telling people it will cure your kidney, it will cure your hypertension, it will cure your diabetes. You are one of those killing us. And then you, that is already CKD stage 3, you are packing them. You have this one from the other company, you have this one from another company. Now rain is raining, everybody's raining. Another one is there. You're packing, taking. Your kidney is already in borderline because you have diabetes that you are not treating. Can you see the connection? Your father had diabetes, he didn't treat, he died. Now you have diabetes, you are not treating. You are refused to take medication because you think it is something that is doing you, but the defect is in your gene. And then you have CKD3. CKD3 will linger, you're killing it, you're pushing things, it goes to CKD4. It's going to CKD5. Then you go into end-stage renal failure. It is only in end-stage renal failure you begin to see people seeking for money, doing GoFundMe and all these things. It's not the beginning or it's straight to dialysis. No, your kidney has the capacity to sustain you even when it's 15%. But when you are end-stage renal failure, everything is gone before that kidney packs. That is what God can do. Your kidney has capacity to sustain you, but you are destroying it more. He's telling you, give me space to breathe. You are destroying it more. And then you start begging because the money to do dialysis and transplant is expensive. Let's be truthful. Even if you are very rich, money rich, when you start it, it will drain you. Not to talk of somebody who is not money rich, to drain you. So that's diabetes. Let's leave diabetes because our time is going. We go to cancers. There are so many cancers that run in the family. So many. Your father had prostate cancer. You may have cancer. You may have that defect. Something can just tweak and bang, you have. So don't say, is there any history of cancers in your family? I don't know what killed my grandfather. He just died. He was sick till he died. He used to pee blood. It was weight loss, and then he died. Okay. Nobody knows that he had prostate cancer. I used to complain of back pain all the time, and then he just died. Nobody knew that he had prostate cancer. Nobody knew. Nobody knew that he had prostate cancer. And then you are having bowel cancer or breast cancer, or your great-grandmother had breast cancer. It skipped your grandmother. And then you. Do we know our family medical history? Do we know our family medical history? Or we are praying, we are fasting, we are on the mountain, we are pouring oil, we are carrying anointed water. Ignorance practice everywhere. That is why you pray. You'll be asking God, I have prayed, God. I have called you. Why are you not answering me? He has answered you. He's given you this sound mind. Use it. He's put things in place for you. Use it. What killed your grandmother? What killed your great-grandmother? What killed your own mother? Have you cared to find out? What killed your grandfather? Why was he in the hospital for so long? Sometimes I baffle. When you ask people, why was he in hospital for 2 weeks? I don't know. They didn't tell me. He was just sick. I don't know. They were giving him treatment, treating him for what? I don't know. They say he's sick. He's sick in the body. Me, I don't know. What if he had cancer? What about you? You are next in the line. Have you gone to say, okay, my father had cancer. I need to start checking myself. I need to start keeping money to check myself. No. No, we are praying. How can I be praying and something happened to me? How can we have had high class, all these people you people call big men of God that have illnesses, their wives have got cancer. They flew them out, they've treated them. A lot of them have got cancer. Be truthful to yourself for once. Face reality. If you don't want to live on this our side of reality, pack your things and go and live in the spirit realm. Because in this part of reality, we face reality. Things will happen to us. We have inherited illnesses, disorders. You have a defect in the gene which you have passed to your children. These things will happen until we find out, until we seek knowledge, we cannot prevent it. Let's be truthful. Let's be truthful. I'm going to move now. Sudden death syndrome. Greater than 20% of first-degree relatives, which is children, parents, siblings, children, they can inherit sudden death syndrome. What is sudden death syndrome? You suddenly die. So they ask you, like here, we always ask this question, and the question goes, do you have sudden death in your family? No, I don't have sudden death anymore. Yes. Yeah, my brother died suddenly. Nothing, he was fine, he was well in himself, just died suddenly. That's a red alert. So this person has to go through investigations, especially the heart, because the thing that will kill him could be a dangerous heart rhythm that they develop at a certain stage, and they cannot come out of it because it's not compatible to life, and they die. That is sudden death syndrome. A lot of families have it. A lot of families are suffering this. Nobody wants to know why. We are looking for who. We are blaming people. We are burning people's houses. We are keeping people hungry. You have abandoned your mother because you think it's your mother that is killing you or your siblings, isn't it? You've abandoned your father because you think it's your father that is a witch that is killing your siblings. Yes? I'm talking to you. You know yourself. Go back. It's not your mother. It's not your father. Your mother may be suffering the same thing that is you're going to suffer. So you better go back and check yourself. You better go back and sit down and give yourself advice. Because me, I have given you the advice that I know that I can give you. So we move on to the last thing I'm going to be talking about is sickle cell disease. Sickle cell disease. Why are we still having it? Why are we still having sickle cell disease? Because somebody who has SS has decided to say, God will help us. We will not produce SS children. So I will go and marry this AS man by faith. By faith, I will go and marry this AS man. So my genotype is AS. Mr. Genotype is AS. I'm going to do sickle cell on his own because I need to tell us the truth is sharp, it's bitter. So that's why most people don't like me, because I will say it as it is. My brothers, they need it as it is. I don't want to quote the truth. I don't want to blend it. I don't want to modify it. You say, Idee, please, the way sometimes you need to just, no, I don't need to negotiate the truth with you. I don't need to pancake it or put butter. I will not do it. If I do it, my own mission is finished. I will tell you as it is. That is my mission, to open your brain and put sense. So you are genotype AS. Your husband to be is AS. You people are two believers. Toban, you pray too much. You drink tea with God. You are always face to face with God. We have faith that when we marry, we will produce AA children. How? You want to remove your gene and wash it? Do you want to cut your body, then spread it, remove your gene and wash it? Because that is the only way. Or do you want to change who you are? Because that's the only way you can change what is coming. Then you produce SS children, then they are dying, then you go into depression, then you are chain reaction. Chain reaction from the single choice that you made. And that choice is based on your religious ignorant belief that you can marry AS when you are AS. Then you start producing. We will pray. We have faith. My dear, I have told you, if you want to live in the spiritual, pack your things. Look for somebody say, where is the embassy of, I don't know. Pack your things. Go to the spiritual realm and stay there. Because here, you're going to face reality. Your child will die in your hands. Your child will die in your hands. You will lose children. You will cry. You will have bitterness of heart because of that single act. It is in the gene. You can't wash it, but you can prevent. You can prevent it happening. You can prevent these things happening. You can prevent. Why can't you prevent? So what is the solution? Number one, when all of us live here, let us go back and do a bit of research. Let's look at our family medical history. Go back and do a little bit of research. If your family member, if you are in a family that people are dying suddenly, you are very important. Go back and do a research. Go and do family medical history. Trace it. Find out what is killing people. Submit yourself for medical check. Submit yourself to check everything. Cholesterol, your heart, your muscle, do an echocardiogram. Look at your heart muscles. Please, I'm begging you. If people are dying suddenly, if you are lost young people in your family, go and start doing research on your family. Please help me put the family medical history. Please go and search for your family. Do a research. What is my family medical history? Do you know that some people, your grandfather had dementia? Your father had dementia and died. Then you begin to behave anyhow. People don't know that your grandfather had dementia because you never knew, never cared to know. And you don't plan. This thing can happen, or let me plan. Family medical history. It will protect you from paying for family covenant breaking, generational curse breaking, family deliverance, family healing, family mountain, family valley, and all this family, you are paying money. Come and bat in this pool. It will take away all your gene. Pool cannot change your gene now. That's the functional, your DNA is you. It won't change it. Go and search. Look for your family medical history. It will save your life. It will save your life. And if you have an inherited disease, stop looking for who gave it to us in our family. Start protecting and preventing, treating, living with it. I'm going to read Vivian's comment. With only 500,000 federal hospital in Nigeria, but that I reject it. People prefer to pay 5,000 to go and swim in Abuja swimming pool. That is the truth. That is the truth. And I leave you with this. My people perish for lack of knowledge. I shall know the truth, and the truth will set me free. If you're on your mission to travel from Abuja to your village to go and do family deliverance, stop. Stop right there. Go back home and sit down. Ask questions. Call. Talk to your uncle. Talk to your auntie. Talk to your mother if she's still alive. Your father. What killed your father? Do you remember how was the symptoms? Come and then write them down. Take it to a doctor and discuss. They say he used to do like this. He used to behave like this. The doctor will know exactly what is going on and help you. If you're on a mission to go and do family covenant breaking, stop. Take your money. Keep. Call. Make a phone call. Call people in your family and ask questions. It will help you. It will help your children. It will help your children's children. Generational ignorance is what you're pursuing, but the knowledge is before you. So I'm leaving you with that. We've gone beyond our time. Thank you, everybody, for joining. Thank you so much for joining. Please, we need to click and subscribe to our YouTube channel. We have somebody now, so I will be doing sickle cell disease. I will be talking about that, and I will do another kidney disease, chronic kidney disease, the different stages, what you need to do at every different stage. So if you're here, go and subscribe, go and like, because we will be broadcasting on both channels. Thank you so much, everybody. I hope this video will help somebody and answer the question that somebody did ask me. God bless you all. Thank you, and bye for now.